I will now welcome everyone back and introduce you to our second to the last speaker. Dale, I told Letitia we're saving the best for the last. So Dale Quigley, whom we fondly call Quig, is the Deputy Coordinator of the National Marijuana Initiative for the HIDA program in the United States. That stands for the High Intensity Drug Trafficking Areas program. He is responsible for providing information and education on issues surrounding marijuana. Prior to this role, he served at the Rocky Mountain HIDA in Denver, in Denver from 2011 to 16 as the manager of intelligence. Ooh, I love that. He later oversaw their training program. Quig holds a Bachelor of Science in Criminal Justice and has been a peace officer in Colorado since 1979. In January of 2016, he retired as a sergeant from the Aurora Police Department. And now he is one of Johnny's ambassadors. Thank you so much, Dale, for being with us here today.
It's my pleasure, Laura, and thank you. And I've got to just real quickly comment about Letitia. Why would you start with such a beautiful, intelligent woman and have the beauty being followed by the beast? I mean, come on, there's got to be a game plan organized there.
We're putting roses between thorns. I don't know.
She's got so many letters. Exactly. I mean, she's got so many letters behind her name. All I've got behind mine is AARP. So at this juncture of life, I guess that's okay. But again, Laura, thank you for the invite.
I wouldn't have missed this slide.
Yeah.
Take it away, Dale.
I wouldn't have missed this. I would have missed this for the world. So, real quick for the folks, I know you've already talked to my partner in crime, Ed. You've heard from him. He gave you an overview of what the HIDA program and NMI is from a 20,000 foot. Let me do two things. I want you to think about a phrase that we've started using. It's prevention through education. We're an information and education initiative, but we really look at trying to address the misinformation and disinformation that's out there about this particular drug, because frankly, I think about the drugs that we have in our pharmacopoeia, this one has got everyone befuddled. Nobody really knows what the truth is. And I've also got to do something you never do. You never start a presentation with an apology. So if you're thinking 40 years a cop, most of the time working undercover, government program now, you're going to hear about reefer madness and demon weed and war on drugs. I have to apologize to you, because if that's what you were expecting to hear, you're going to be disappointed. That's not my messaging. Our messaging is about getting the truth out, and that's kind of the goal today. I want to share facts with you. No BS behind it. Everything is site sourced. I want to make you a better consumer of information, aware of a broader picture. And at the same time, I'd like to challenge you. If you hear me say something, you see something on the screen, you go, yeah, that is spot on, or you go, oh, that's BS. I want you to stop for just a second and step back a little bit and ask yourself, why do I feel that way? Why do I believe what I believe? What is the source and the basis of my knowledge? Is it something from peer-reviewed information, or is it something from my peers? Is it something from social media? Because there's all kinds of misinformation out there, and that's what we're trying to do. The greatest takeaways that we've got about this drug right now is when we talk about legalization, especially in Colorado, this is a complex issue. And the 30 minutes or so we have together today is 30 minutes out of an 8-hour class. So this is going to be kind of a high level and a fast skim, all right? But we got to understand how polarizing this issue has become. And it's not as simple as yes, no, yay, nay, red, blue. It's just not that case. When we look at legalization by a state, we see a lot of consequences here. The first consequences that comes up is you legalize it for either commercial purposes or medical purposes, and it automatically puts you in conflict with federal rules and regulations. So when we look at the issues here, we have to understand that there's all kinds of promises and platforms these things are built on, but we have to understand what the consequences are. And one of the other consequences from being polarized by nature of this thing is both sides, the far extremes of the side, suffer from the same disease. Don't confuse me. My mind is made up. I don't want to hear facts. And the first real takeaway that we have here today, folks, is what we need is more research, more valid research into today's products, the potency levels that exist today. The research from before is great fundamental stuff, but it's new data that we need. It's the new research we need. We need to understand the pharmacokinetics and pharmacodynamics of what this new drug, what these new potencies really mean. when we sit through these presentations, and you guys have done great. I've been watching the numbers all day of hanging in there. I mean, Zoom fatigue it's terrible, but there's so much data that gets thrown at you. So I'm not going to just throw data at you. I want to talk a little bit about it. So when we look at data, how do we look at it? We got to look at it like basically like seeds. And when a new issue comes along, we start planting seeds out of research and data. So we start finding out these points of information in the first couple of years, and we look at them. It's like, okay, the first year or so, oh, that's nice, it doesn't mean anything. But then when we see the trending data start to develop, especially over time, then we can start putting our hat on a few things. We never want to hang our hat on one piece of data just because it fits our argument, right? We have to be able to take a look at this, and we have to be patient. Some of these things we'll understand in a few years. But look how long it took us to understand neonatal abstinence syndrome. Look how long it took us to understand fetal alcohol syndrome. Look how long it took us just to understand alcohol and what it does to the human body and the biomarkers we have from there. You know, everybody wants to turn to Colorado as the source and the gold mine of all information. Well, guys, we legalized this medically in 2000, despite the fact it's a Schedule I drug and still is. So it has no accepted medical value in the US. We legalized it recreationally, commercially in the 2012 elections. We're still figuring this stuff out. There are still all kinds of questions that arise out of this, even with our nearly 20 years of experience. So the takeaway for you guys today is we're going to look at some data, we're going to talk about it, but I want you to look at Colorado and understand the evolution of how we went from a non-medical state to a medical state and finally to a recreational or commercial state. The reason I offer this to you, especially if you're in a state that's looking to go down this path or is new to this, look at what's happening in Colorado and our data points and use it as a predictive analysis tool, okay? So to understand what happened with us in the past, Amendment 20 was passed back in November 2000. This was our compassionate care. It allowed for 2 ounces of weed, 6 plants, and you could have a caregiver assist you in that premise. When we look at this, I've got so much respect for the industry because this is a constitutional amendment, which means even if the governor wanted to, couldn't overturn it with a veto. It has to be done by a vote of the people. And 2 ounces by itself doesn't seem like a great deal, but when you figure that if every medical patient in Colorado, which is about 85,000 right now, has access to 2 ounces, how much product has to be produced to sustain that model, okay? Now, from the year 2000 till about 2009, it's kind of languished. Nobody really knew what to do with it. Cops didn't know how to enforce it. Prosecutors didn't know how to bring it to trial. Judges really didn't want to hear it. So the hands-off approach by state and local law enforcement happened. In 2009, the Department of Justice released a thing called the Ogden Memo, where basically they said, we're not putting federal resources into investigations where someone's in compliance with state law. Well, the byproduct of that was now nobody's taking a hands-on approach. We went from a benign little state trying to figure this out to floodgates opening up. We started with 4,800 people in the state going into 2009 that had medical marijuana cards. Suddenly, when these memos came out, our applications dropped up. All of a sudden, we had dispensaries popping up like mushrooms in the front lawn after the rain. We went from 4,800 card holders to 41,000 in the course of 1 year. And by the time we got to 2010, something interesting happened: market saturation. There was too many shops to support economically the industry. And this is where we saw a lot of the little mom and pop shops kind of go away. Oddly enough, this is also the first time that we started to see large scale corporate marijuana coming into Colorado and kind of chewing up the industry a little bit and buying up some of these little shops. That way they could be vertically integrated and have a good, strong foothold as far as a business model. You know, we talk about business models in this next slide. I want you to take a quick look at the top right-hand corner. June of 17. This is the last time Starbucks and McDonald's cooperated with us when we asked how many shops they had. I guess they didn't like to be associated to this. But as of June of 17, this is the number of retail shops that Starbucks and Mickey D's had. And here's the number of dispensaries that we had. Well, by contrast, take a look as of April 1st. Look what's happened to our marijuana dispensaries. They've gone down to 429. You take a look at our retail shops, the adult use only, and look how they've grown. Understand that this is where the money is. Prior to Amendment 64, the only game in town was medical. That's represented by the blue bars. These were the dispensaries and storefronts that we had. And notice that since 2014, the green bars, the recreational licenses, how they've increased by at least 100%. And what has happened here, and this is important to follow because this is the reason why you have to follow the money. I know Ed spoke to that. You have to follow the money and understand why there's a push from medical to recreational, because that seems to be the pattern. First we decriminalize, then we go medical, then we go recreational. So this is the process we're looking at. Here's the why behind that. When we take a look at this, that blue ball right there, that's the state of Colorado, about 2.7 million people. That little green slice there, that's the number of people that hold a medical marijuana card. And it works out to about 200 people at a dispensary. Well, that's not sustainable. That medical model by itself services a very specific segment of our population, and it's just barely over 1%. What we need to do is we need to follow the example of the industries of addiction. Look at the liquor stores, look at the tobacco industry, look at the industries that service individuals that are age restricted. So in Colorado, when Amendment 64 went through for commercial use, all of a sudden now we've got a market that opened up to 70% of our state is over the age of 21. All you gotta do is walk in the door, proof of age, and put your money down. And the great thing about this model is that every day of the year, someone ages out and becomes of age and can move into this age group. When we look at the states that have legalized it, the first ones, California, Washington, Oregon, when they went medical, it took them almost 16 years to go to a commercial recreational model. The next generation is Colorado and those guys. That took us a little over 12 years. When we look at the big shift to rec, now we're down to 5 years. South Dakota, this last legislative cycle, voted for both and passed both in the same cycle. Now, when we look at the Amendment 64 for our commercial use, it follows the same model as the first one for medical. Age restricted, up to an ounce, you can have 6 plants. We were really sure this was going to kill the card holders, but surprisingly it didn't. When we looked at the card holder numbers, they stayed very elevated until about 2017, and that's when we started to see the real dip take place. Now, the one thing our state that did well is we have one reporting site. So if you sell commercial marijuana in this state, it goes to one place. So we can track the edible units by year by the product units sold, and you can see that edibles are very popular. We're still selling raw bud because people still like to roll it and smoke it. And we can see that those numbers jumped. Look at 2017, over 500,000 pounds of product. And keep in mind that this is a product that's used in terms of grams and quarter ounces and half ounces. Okay, that's a lot of product sold. What we started looking at was 2018 and 19, and looking how the numbers went down, and we're trying to figure out what was replacing that. And the answer is this: the answer is concentrates. Okay, quite frankly, the market is willing to pay that extra money to have concentrates. When we look at potency levels, we have raw biomass of raw weed in the 20s and 30% range. From those high potency products, we can make concentrates in the 60 to 70, 80%. Top row, one in from your left, where it says crystalline. What that is THCA, tetrahydrocannabinolic acid. The botanists and scientists and the agronomists have all got together, and they figured out how to extract that, isolate it, and crystallize it, and can sell it as a standalone product. What makes that so attractive is that once you apply heat to it, it goes through a process called decarboxylation, and it turns to THC. That way you can inhale it and ingest it that way. 99% potency is what this product is being billed at. And when we look at the product units sold for concentrates, this is what's making up the difference. People are willing to spend the money if they have the concentrates. And money is, when you get down to it, guys, marijuana is not a black thing, a brown thing, or a white thing. The only thing it's really about is green, Federal Reserve notes. And there is a lot of money to be made in this. When we look at the amount of money coming in from medical sales and recreational sales, it adds up. But the change that took place, that used to be 20% of the total tax revenues. Now it's down to less than 4%. And in 2019, we were bringing in almost $800,000 a day. In 20, almost $1 million. And that's based on $2 billion in sales. And our tax system has a tiered tax system. So if you're buying recreational, you're paying 30% and you only get up to an ounce. If you're buying medical, you get 2 ounces and you only pay about 2.9%. And all this is great, but you know what? Nobody knows what it's costing us. What's the cost to social justice? What's the cost of medical? What's the cost of science? We don't know these numbers. So I can't even tell you if we're in the red or the black on this thing. And the windfall that we were promised through legalization, we're sitting here less than 1%. That's what it brings to our state. Now, instead of talking numbers, let's do a quick shift here. Let's go to public safety. Everyone wants to talk about highway safety. You know, people are dying. Marijuana is becoming more prevalent in these accidents. Now, stop what you're doing real quick and listen to me. I am not saying marijuana causes these accidents, okay? What I am saying is the presence of marijuana is becoming so prevalent in our community that we have to start looking at these things. Are these causational factors? The same way we have to look at drunk driving, impaired driving, distracted driving, fatigue driving, okay? What we do know is that the number of crashes in the state of Colorado post-legalization, since legalization, have increased by almost 21%. And to be fair though, we've got more people moving into our state. So that could also account for it. When we look at the total fatalities by year pre and post legalization, what we have seen is that they have gone up since 2013. But again, I'm not saying marijuana causes these. What we look at is our total accidents in Colorado have gone up by 33%, but our drivers that are testing positive in fatal accidents are up by 91%. Now you got to start looking at cause and effect. Why is it after the legalization took place, we have seen such the prevalence of marijuana in our drivers? 33% of our drivers are testing positive for weed. 35% are testing positive for weed and alcohol, the two together. And combined, they're even more potent, okay? The usage makes no sense here. When we take a look at adult usage, and by the way, this was from 420, about 4 or 5 years ago. So when we take a look at adult usage, we look at current use rates, and that's once in the last 30 days. And what we can see is that within our 12 to 17-year-olds, the use rate is it's nominally higher than the national average in blue. And if this is such a benign drug, why is it that marijuana is the #1 drug for 12 to 17-year-olds that are in drug use treatment for substance use disorder? And unfortunately, we're seeing an upward trend, not only in Colorado, but also nationally since 2017. The 18 to 25 folks, that's the largest cohort. They start at a much higher level, and look how much higher they are than the national level. And what's interesting, the old guys, us, we're now the largest cohort of people using. And a lot of it has to do, they're looking for alternatives to opioid medicines and pain relief, okay? So people are choosing to initiate this as an option. But the 26 and older, that's the largest group that we have. When we look at initiation rates too, what's a little scary is we have to think about the industries of addiction here. You look down at the bottom, alcohol, marijuana, prescription opioids, it's huge. It's absolutely huge. But when we look at 3.4 million people, what's that mean? Well, it's about 9,500 people a day decided, yep, today's the day I'm going to do it. And you break that down, it's about 400 people an hour said, yep, right after Quigley's done talking, and who could blame them, I'm going to light up. It works down to about 6 people a minute, about 1 person every 10 seconds. And sadly, this has been going up since 2016, 2017, and 2018. And a lot of that has to do with this is the perception of fear. The perception of harm by marijuana is so much less than that of cigarettes and LSD and alcohol. People don't understand the risk that we've got here, folks. We're missing a messaging opportunity here that we have to seize. So real quick, here's just a quick slide for summary. When we look at marijuana in Colorado since legalization, not because, since legalization, since implies from a time, because implies a causation correlation, all right? So since marijuana was legalized in Colorado, the presence of marijuana in our fatal accidents has gone up by 91% for those tested. When we look at the use rates by our various age groups and compare that to the national age group, our 12 to 17-year-olds are starting to trend up, 43% higher than the national average. The college age kids, 50% higher than the national average. And the old guys like us, here we are, 91% higher. And if you can hear the alarm, it is 4:20. So think about your kids. If you need to shoot them a quick text here in Colorado in the Rocky Mountain region, just tell them you're thinking about them and hope that they're making good choices. And that ties in so well with the next point. The perception of harm is so low. We need to address this with facts, not scare tactics, but facts. And what we didn't cover today, just for time, hospital admissions and poison control calls, they're all going up. But do me a favor, I got like 1 minute left. Get your phones out for a second because I got a QR code I want you to look at. Wrapping up here, I really like what Mark Twain said because I think it really sums it up so well when we talk about this, okay? What gets us into trouble is not what we don't know, okay? But rather it's what we know for sure that just ain't so. So when we look at this, the question comes, all right, we've got all this misinformation and disinformation on one side. We've got research starting to show that the earlier you use marijuana, the more frequently you use it, the more potent a product you use, the greater your odds ratio and likelihood of developing a substance use disorder or a cannabis use disorder increases as you get older. And what the damage it has done to the body, especially the developing mind with the kids, we have to remember that mind is precious, but it's so very fragile. I heard a commentator today on one of the other presentations I was doing. It's a Surgeon General out of the state of Arkansas. Says he tells his kids, I don't want you drinking until you're 25. I don't want you even trying this stuff till you're 25. Because I want to give my kids a chance to have their brain fully developed to go in a healthy, productive fashion. Okay. So where do you go? Where do we sort through the BS and the clatter? Where can you go to find what you need to find? Well, here's where you go. Try our website. What our website is going to offer you, and if you use that QR code, it'll take you right to the website. Our website is about facts. It's about research. It's about education and information. That's what you're going to find there. Everything is site sourced. It's unbiased. We've got impact reports like coming from the Rocky Mountain HIDA, from the other HIDAs. We've got some great environmental videos about what's happening in our public lands and trespass grows that are happening there, and just the terrible pesticides and herbicides that they're using there. There's great information out there, and it's neutral. That's what you're going to get from that site. What you're not going to get is reefer madness. You're not going to get demon weed. You're going to go blind, war on drug stuff. No, it's about finding a resource and an opportunity that you can avail yourself to, that you can share with your kids, you can share with your coalitions, and take that information and move forward with it. Okay, so it's simply thenmi.org. Okay, that's a QR code that'll take you to the website. If we could do this in person, and I really wish we could, we'd have opportunities after here to have sidebar conversations and swap business cards. Here's what I'm going to offer to you. If you have a question that we don't address today, or something comes up, or if down the road you go, gee, I wonder if, keep my email address, shoot me a text, just say, hey, I was at Laura Stack 420 and in 2021, you gave me the email there. I've got a question for you. The great thing about this is if I don't have an answer, I can probably find out who does, and we can share that information. That way it's a learning moment for both of us. And typical with any federal program, that little QR code down there, that's a second QR code. What that will take you to is to a survey. These are in-house surveys that we do. We recognize that some people maybe don't want to come up and have that conversation after a meeting, or have a really good idea, or have really good feedback that they can provide. Well, this survey allows us to tap into your brain and trap that information. You can do it on your phone. It'll take you about 3 minutes to do. And if there's a topic or a question there that you'd like to have addressed, put it in there and we'll bring it up from there. Just make sure that you leave me an email address on the other end of that thing, okay? So when it gets down to it, just to kind of bring this back full circle again, we're trying to take the misinformation and disinformation and replace it with good facts. And there is so much great information emerging out there. That's the one good thing, in my opinion, that's come out of the legalization of marijuana. We're now getting good research into today's products in today's marketplace, right? The potency levels that we've got now with raw biomasses being in excess of 30%, concentrates at 60 into 80%, THCA into the 90% range. If you want to put it by an analogy, THCA is to marijuana what crack was to cocaine, what ice is to methamphetamine, what fentanyl and carfentanil is to prescription painkillers, or maybe a little more gutter basis on this, it's what Everclear would be to wine or 3-2 beer, okay? We have to have a good understanding of those drugs, because that's what's in the market today. That's what our kids are initiating with today, and that's the problem that we're going to be dealing with for quite a long period of time ahead of us, okay? So I'm going to leave this up for just a quick second here. Laura, I know you wanted to do Q&A, so I left you some extra time for Q&A on this one. So with that, I'll turn it back to you, Laura, and we can go back to the Q&A section.
Okay, thank you so much, Dale. Living here in Colorado has been so challenging for our family, and you just gave us some of the the realizations why that data is so important to look at. And I think, your point about it's not necessarily causation, but I think we could certainly argue correlation and
Yes.
association, and some of it is kind of leaning toward that causation piece. I'm going to take you off so we can see. There we are. Now we can see
There
you
you are.
better. So talk to us about what do you know about the bill that is supposed to come to the House floor? How will this help some of these trends that we're seeing? What do you see as some of the key components, and especially how will it safeguard our youth? I think some of our other coalitions would be interested in what they might be able to do on a local level to see some of these changes.
Yeah, I think one of the greatest things that comes out of this bill is the fact that it's actually talking and putting caps and limits on potency. Right now, there's not out there. It's, this is Dodge City when it comes to potency. Whatever people are willing to spend the money for, the industry is willing to produce, and to damn with the consequences. So by limiting the potency caps on this thing, I think it's a huge step in the right direction. We look at countries like Amsterdam, they're even now saying, anything over about 15%, we're classifying that as a hard drug. And going back to when this legalization first took place, we saw the potency levels starting to go up. But even the industry said, oh, no, you'll never see anything higher, maybe 10 or 12%. Well, we are miles past that. I don't think there's any way that the industry even could have foreseen the attraction to the potency of concentrates, the convenience of edibles. Okay, so if we can start putting a cap on that, that starts to address the first issue when we talk about early initiation, early onset of use, frequency of use, and the higher potency that the kids are exposed to. All right, so to me, that cap on potency would be a godsend.
And what about this process we have here in Colorado, fondly called looping, where it's really not tracked? I understand the bill is supposed to put a program in place, much like the opioid tracking, where now perhaps instead of going from dispensary to dispensary from dispensary, they will be able to monitor who's purchasing what. Is that something you see happening from your intel, what you're getting?
I don't know about intel, but I certainly would like to see that happen. I mean, for the folks that understand how Colorado is set, for our medical patients, they apply to the state, they get a recommendation from a doctor. You can't prescribe marijuana because it's a Schedule I drug, so you can't prescribe it because it has no medical value. So they get a recommendation, they get the magic little cart, they go into a dispensary. Remember I said these are purchases that are tracked. So when Dale Quigley goes in and buys his gummy bears and a quarter ounce of Purple Haze Kush, it gets registered in the state and there's a record of that. If I come back in, there's another record of that. But as an adult purchaser, it's just like walking into a liquor store. I walk in, I show proof of age, I put my money down, and I walk out. And they go around the block. That's why they call them loopers.
And
they go around the block and come back in. What we see is diversion out of state of these products. You get groups that come in from other states that are non-marijuana states. They come into the state, they show proof of age, several of them walk into the store, we all make our purchases, we make a loop around the block, or we go across the street to the next dispensary or the next dispensary. It's like a little bee going from flower to flower to flower. And they buy up the product and then they bring it back to your state, your home state that's a non-marijuana state, and they sell it for exorbitant prices. Because why? It's from Colorado. Everyone thinks that we have got just the primo weed in the world. And I'll be honest with you, the industry is growing some good product. I've been in a lot of marijuana grows in my career, and these are some really nice looking products they're producing. But there has to be a cap on the potency. There should be limits on how much you can purchase. And even the same way with alcohol. I think there should be some limits on how much that you can purchase. But the problem with this order, in this discussion, it's going to cost people money. The industry is going to lose money on this thing, and that's why you're going to see a fight on it.
So you mentioned someone was even asking how much of that is shipped out of the state. Do we know any estimates about how much of our Colorado product is brought out elsewhere? Do we know that
really
figure?
no way of knowing. First off, it's not to be shipped out of state. Everything's supposed to stay in state. So we look at the sales that take place over the counter legitimately, but what about the transactions under the counter out the back door? Or you're working with a third-party middleman, or you're working with somebody in the black market. And if you ever use the term gray market, please eliminate that. There There's no such thing as a gray market. It's either legal or it's illegal. It's like being pregnant.
Give
There's no
everybody
middle
just kind of a brief on black market, gray market. Kind of define those terms for us.
Yeah, black market is the market that's operating outside legal boundaries, period. That's it. There's no such thing as a gray market. People want to use the term gray market. If the rules say that if you're going to run a marijuana business, you got to follow these rules. And if you're breaking those rules, well, you're contrary to law. So that puts you into a black market environment when you do those secondary type of deals. But for us, one of the stories was, well, if you legalize this and you tax it, you're going to drive the black market away. No, that's not the case. What we did is we gave an opportunity for the black market to operate and hide in plain sight. So we still have illegal grows in this state. We still have organized crime in the state. We still have drug trafficking activity, drug trafficking organizations, gang activity, selling drugs, and marijuana is a huge money cow. Still is, and probably will be for a long time.
And what do you see in Colorado high schools and middle schools? Do you go out and speak to some of these schools? I've heard the term gray market used when, like Johnny, could go get a medical marijuana card, go to a medical marijuana dispensary, purchase far more than he could ever use for personal use. And then we saw photos in his phone of him going back and then selling these products. And it's been said that in Colorado, and I'm sure Washington, California, name your state, where it's legal, that teens can, in 5 minutes, get a hold of marijuana. And sometimes that's what's kind of being called the gray market, because they're not buying it from illegal grows. They're not producing it themselves. They're getting a legal medical marijuana card by making up some chronic illness that they have and then reselling it. I think that's kind of where the term comes in. But of course, that's still highly illegal. Yeah. So that's not what we want to use with this kind of gray market terminology.
Yeah, when we look at educating the kids, and again, this is something I know Ed touched on because we both agree to this. We need to get to the kids young. Okay, this should not be a class in their third quarter of their junior year, a part of a health curriculum. This should be messaging that's consistent from the time they're in grade school, middle school, and high school. And what the kids are telling us is that, just tell us the truth. Don't tell us we're going to go blind, or our hands are going to fall off, or something bad's going to happen. Okay, because the fact of the matter is not everybody that uses marijuana gets addicted to it.
True.
But about 1 in 5 will. And what we try to stress with the kids, I teach a class for a local high school here. And what we try to teach the kids is that, especially at that age, think back when we were teenagers, man, we were immortal. Our concept of life there was no concept of mortality associated to it. All right. And again, that's part of the brain development. That whole prefrontal cortex is still in the developmental process. And, the amygdala and prefrontal cortex, if they're not talking, well, okay, risk reward and taking chances, that the system isn't developed. But we try to explain to them that, yeah, okay, 1 in 5, that means 20% might, not everybody, but we always think it's going to be the other guy. Well, I'm not going to get COVID. I wear a mask. I'm not going to get COVID. I got my vaccinations. But yet people still will get COVID with the vaccination. They still get COVID with the mask. It can happen. And that's what we try to drive home to them. Here's the facts. Be your own advocate for getting good information. When you read something, when you hear something, especially on social media, and I think Letitia was spot on. When you get this one drug that is now the wonder drug, and it's going to cure everything from the heartbreak to psoriasis to acne to male pattern baldness.
Crazy.
Okay. Yeah, you got to raise the BS card. But again, this goes back to research. If we don't do good research, how are the kids going to find the information? If we don't do good research, how are we going to find out what this plant is really capable of? If we don't do good research, you take 100 and some odd cannabinoids in the plant, my gut tells me there has to be a combination in there of 1 or 2 of the cannabinoids with the properties of the plant that has to have some value. Look what we learned about CBD and Epidiolex in the treatment of very specific neurospastic disorders in kids. All of a sudden, okay, there's a value here. And that's why through research, through education, through FDA approval, we came up with Epidiolex.
Yeah.
All right. We didn't elect it like a prom queen by choice. We have no other drug that we elected into our pharmacies. Okay. You know, you walk into your pharmacy, you ask for recreational opioids. You're not going to find them. But yet we put these stamps on things because it's convenient. This is medical, this is recreational. And again, this is what the kids need to understand. This is not a simple issue by any
What
stretch of
about
the imagination.
the teens and the data that we've seen coming out of the Colorado Department of Public Health and Environment around suicides? I haven't
Mhm.
seen 2020 data. For that matter, 2019 data is kind of hard to come by. It's almost like, you know, they're holding it tight to their chests. But I did see in 2018 that for youth ages 15 to 19, nearly 36% had THC in their systems in suicide and in toxicology. And it's so much harder for teens to get a hold of alcohol than it is to get a hold of marijuana. What do you know about these trends, and have you seen anything continuing in that direction with an increase in suicides and toxicology reports, that sort of thing?
Now, I've seen the same numbers that you have,
Okay.
and we're starting to see the same patterns develop elsewhere. That's why if you look at what's happening in a state that's legalized, you can use that information as a predictive analysis tool to start looking at things in your state. You pick up this rock, does it really exist under this rock in our state? At least you can be aware of it and start looking for it. So,
Yeah.
you know, the trends that we're seeing with kids, we're seeing that upward tick that I talked about. And it was going down for a while, and that was so great. And then one year it goes up, and then the next year it goes up. And it's like, here we go. And I'm really hoping this little upward tick that we've had since 2017 plateaus off. You know, why did it go down from 2013? We're not sure. Why is it ticking back up again? We're not sure. You know, sadly, that's one of the byproducts when you look at raw data. It just tells you part of the story. You don't get the backside of the
Right.
causation. Why are these numbers taking place?
Can you tell us, since we have you on the line, about some of the things that the National Marijuana Initiative can do to help smaller coalitions and DFCs? What are the services that you
Sure.
provide? You know, how can you help smaller coalitions? I know a lot of them are facing these sudden sweeping legislative changes in Virginia and New Jersey and Maryland, which was defeated,
Right.
thankfully, in New York. You know, what are some things that you can do to help?
And now a word from our sponsor.
Yes,
So,
thank you.
no,
If
essentially
you
what
don't
we can do,
mind.
we work with the DFCs, with the CADCA community. Helen Hernandez with the DFC program is a fabulous lady. She's one of my heroes. And what we've been trying to do is that when we schedule a speaking engagement for a coalition or for a DFC coalition, Drug-Free Communities Coalition, we ask them, do you work with the other coalitions in your neighborhood? You know, whether it's a DFC or if it's just another anti-drug coalition. And what we're finding is a lot of people don't.
Ah,
It's almost like we were siloing the information. And I know Ed spoke to this because I caught the tail end of his presentation. Everyone's fighting for those same grant dollars, and I get it. But what we're trying to do is, one, between the coalitions, bridge that information gap so that, okay, yeah, your coalition may be hosting this, but our coalition can benefit from the information too. So it's a chance of
absolutely.
reaching a broader audience it's interested in the information. The other thing that we do, and I mentioned earlier before when we were on the break, is we have a speakers bureau. And if you go to our website, thenmi.org, click on speakers bureau, that page is about to be revamped. So that's going to change it in its appearances. But it'll kind of give you a rundown of all of our different speakers and the things that they speak on. You know, everything from environmental issues, obviously suicide, death, and loss, making choices. You know, we got one gentleman that works with the prison population, and so many of their people got to where they're at, and they started by smoking weed. That was the first hurdle that they went over. So you can take a look at that. And what we do with our speakers bureau is we come to you where we're doing physical presentations. We pay our own way. We pay the flight, the airfare, so we save you the dollars. That way your coalition isn't out the dollars. You can keep the money local where it's going to do good. Some of our
We're
speakers do
virtual,
take it on.
like these.
Yeah, yeah. And some speakers take an honorarium and we let them negotiate that as a private transaction because this is what they do for a living. This is how they feed their families. You know, I don't take an honorarium. Ed and I cost you absolutely zero to come to speak to your organizations, okay? What
Thank
we
you.
started doing here is with the Zoom platform back in April, we saw what was happening with COVID. We got site licenses for Zoom. We started hosting the Zoom calls, and that has progressed into us now handling the registration process, doing an online registration process. We do the survey of the information at the completion of the events. So we've morphed from just coming to your place and standing up and death by PowerPoint to more of a service oriented to, again, education and prevention being tied together. And the feedback we've had from this is absolutely fantastic. Some of the other stuff we do is research. I'm trying to find out about this, or we've got this particular bill. And while we cannot lobby or do anything along that way, we can educate and we can inform. Ed and I have spoken before state senates and judicial committees for several years now. And again, not to lobby or try to influence, but just educate. Here's what's going on in Colorado. You know, do you want it to happen in Minnesota, Arkansas, Kansas, Virginia, whatever state it happens to be? It's just a chance to educate.
Exactly. And even though we can't spend dollars on lobbying, we can share stories. I share Johnny's story all the time. And this is what happened. And this is my experience. And even though we're a 501c3, we have the ability to do that because we're not influencing or trying to tell people how to vote on a certain bill or things like that.
Exactly.
But we can certainly educate. And the NMI speakers are fantastic. And you are no exception. You have brought great information to us. I know everybody is going to go back and look through those slides because they're very detailed and a lot of really good data. And I like to see the trends. I hope we continue to see the trends improve. Unfortunately, like you, I think, you know, in Colorado, at least that horse has left the barn. And so we have to continue to educate and try best we can to reduce the perception of harm. Or increase the perception of harm, reduce the gap that teens seem to believe that, you know, this stuff is, everybody's doing it. To Ben's phrase, it's just weed. So I want to thank you so much, Dale Quigg, for not only being with us here today, but for welcoming me into the Bureau, for being such a great partner, and for putting together such a great group of speakers from which to pull. So we have one more coming up after you, Monty Stiles. As we always,
Monty.
I love Monty. We always say we save the best for last. So nobody go anywhere. We have a very motivational ending to you, for you to the day. And Dale, thanks again so much. And I look forward to seeing you soon.
Take care, everybody. Have a great weekend. God bless you.